So welcome again, Cindi. Let's just start this webinar. We have new grads here willing to listen to your advice. And I'm going to record this because I actually have a lot of email. They say, oh, I'm taking the boards today or I'm working today. And it's understandable. It's a Wednesday. Nobody's exactly prepared, to have to jump on a webinar. But this is the great part that we're going to record it and send it to everybody so we can all share this message. So Cindi, if I can introduce you to our listeners today. So you are a lot, right? You are registered dental hygienist. You're also clinical team leader. You're a coach, and you work for over 40 years in dentistry. And right now you're the clinical team director at Dental Care of New Jersey.
I am, absolutely. It's only been 30 years, 40 years. I would be a little bit older.
Okay. 30 years.
A little over 30 years.
Perfect, perfect. Thank you so much for being here on a Wednesday with us. I know your time is super precious. And I know you are super busy. I know you are just running everywhere and you have a lot of stuff to take care of. So thank you again for being here, and let's just jump right into this, right? So I want to share with our listeners why, I thought Cindi was awesome, and what I really was excited to have her here is because, first of all, when she replied saying, okay, can I do this with you? She came with such a big heart, and she wanted to give back. And I know that those are rare. I mean, obviously we all want to give back, but however, for her to take this big step and to really come forward saying, I learned so much in my life from other people, I can do some things for the new grads right now that really meant a lot for me. So I was really excited to have her. And on top of that, obviously her experience, what she has done speaks for itself. And we have so much to learn today. And, it's going to be awesome. So Cindi.
Thank you, Zara's wonderful introduction. You're right. I do have a lot of experience. And the reason I did contact you about it was because I wanted somebody to mentor me when I was younger and a graduate. And I didn't, unfortunately, have that. So when I got to a point in my life where I could feel confident in doing that, I really reached out to try to do that. I do that in my day-to-day work, but I also reach out to new students, new graduates, even people who interview with me. I always say to them, please don't hesitate to contact me with any questions or, things like that. So, yeah.
It's really good to know. So you found your own mentors when you were, going through your career. And how did you find them?
That's something I just asked. I networked a lot. I would just pick people's brains. I learned. I did a lot more listening than I did talking. I listened to people who, weren't even in my league.
Okay.
Doctors, dentists,
I see.
podcasts, webinars, those sort of things. So I just really listened and asked.
Amazing. Okay. So let's not be afraid to ask. Let's go out there, get advice. And the worst thing is like, I'm busy.
Absolutely. What are they going to, what's the worst they can do is say no.
Right.
And then that's not your path.
You're right. And there's so many people out there. So that's a great encouragement. I love starting on that.
Outside of dentistry too, for mentors.
Good point, because dentistry is one small industry. There's medical as well, but not even that. I get my inspiration from the startup world, people who do technology. I have a friend here I talked to today. He does drones. I mean, it's not related to what we do, but gets our mind going.
Medical equipment device companies. There's so many avenues that you could go down.
Okay.
Fortune 500 companies, those sort of things. So
yeah.
think outside of your dental box, if you will.
All right. That's wisdom number one already. There's so many. We're going to have so many key points today. I'm going to make some notes as we speak as well. All right. So, there are many things that we prepared and we said, okay, we want to talk about this today. And, we don't have too much time. So I want to just jump right into, first of all, let's talk about burnout, because we're in the dental industry that always talks about, oh, hygienists are going to burn out. Like we all burn out. And even my sister, she's a dentist. She's burned out already,
Yeah, absolutely. It's a real thing. This is a very physically demanding job that we have. It's also very mentally challenging. You have patients who come in who, the first things out of their mouth is that they hate us. They hate the dentist. So it's physically demanding. It's emotionally demanding. It's mind demanding. So avoiding burnout is a real thing. And there's many ways to avoid burnout. But I think the biggest thing is to stay engaged and keep challenging yourself.
Okay.
And to know that you're not just a tooth cleaner. And by that I mean, you know, the definition of insanity is doing the same thing over and over again. So if you just approach your day that you're just going to be cleaning teeth as a hygienist, then you will burn out quickly.
Okay.
So I have a few strategies that to avoid that burnout that I use. I mentor my staff with as well, and we can talk about that if you'd like.
I would love to some examples or things that you already done.
Yeah, I mean, you can't approach everybody as the same. And as I just said, you know, not everybody's a cleaning. I think that the first and most important thing you do is you have so much knowledge coming out of school that all you just want to do is get in there and clean teeth as fast as possible. But I would say as a new graduate, the number one thing you need to do is just back up a little bit, take a breath, and really assess your patient first. There's 5 key ingredients that I use and I teach that really will help you in going to the end of burning out and just cleaning teeth. The number one thing is medical history. You have to assess your patient with their medical history. You have to know what medications they're on, how many milligrams they're taking. Did they take that medication today? And that's a very key factor. They may take the medication, but they may not have taken it today. You know, you have to talk about your diabetic patients. And what that does is it actually helps you to make a treatment plan later on. So the key ingredient is, number one, is medical history.
I see.
The second thing is, did you want to speak on that at all anymore?
Oh, no, I mean, I love it that you're right that when we graduate out of school, we're like, oh my God, I want to do this. And that's all. It's like, oh my, give me the instruments. Like, I don't, I remember that too. Because at school, it was all about passing, you know, the grades. And you're like, I just want to be in the zone and doing that. But we forget that actually it is for the patient that we have to pause and think about them, assess them to really just give the best care. So I love that point because I was there already, and I'm sure a lot of new grads are in that position.
I have been tremendously there, and for many years I just thought that that's what I was supposed to be doing, was just going there and cleaning teeth. So backing it up a bit is the key is to assess your patient. So the second thing to assess your patient is x-rays. And I would challenge new hygienists to find an office that wants you to take x-rays because I've worked in offices that, you know, it's only bite wings. Well, you know, there's a lot of other teeth in the mouth besides, you know, checking for interproximal decay posteriorly. You know, if you don't work in an office that is allowing you to do that, and you have to think, you know, is that really for you? Assessing your patient with x-rays, making sure you're taking anterior PAs, making sure you're taking panorexes every 3 to 5 years, full mouth series, checking those root canals. You have a patient who has a lot of restorative and periodontally involved. You really want to take vertical bite wings. Just because the policy is to take horizontal bite wings once a year, again, get outside of that box and challenge and talk with your doctor. You know, I don't think this is the right thing for my patient. So assessing your patient with x-rays is a factor.
I see. Okay. Because x-ray, like, I mean, we're going to talk about interviewing more later, but quickly to touch on that, I never actually thought about asking about x-rays when I interview at an office, saying, okay, what kind of x-rays do you guys take? But that's actually a good question. It really tells a lot about their philosophy, how they care for the patient, the pace that they're going through. Do they follow the guidelines of, like, you know, you shouldn't, you know, expose a patient in certain rigor at a certain age or things like that?
Correct. All of those things. I actually have that in for notes for later for the interviewing. So you're absolutely right. It's a great question to ask as a new graduate and new interviewee.
Awesome. I already learned. We already learned.
Wonderful. Excellent. You know, x-rays check between the teeth for cavities, check for abnormalities where we can't see clinically. The other third part of this assessment tool that I use is intraoral camera. You're checking the integrity of the fillings. You're checking out fractions. You're talking to patients about their smile. An intraoral camera, I have to say, is probably the biggest thing that I would not work without an intraoral camera in my future. I still do clinical practice a few days a month, you know, certain times a year I do. But the intraoral camera really brings things full fold to your patients.
I see,
So
I see.
that's part of the assessment. You're going to check for, cracks in the fillings, fractures, abfractions. Do they like their smile?
I see.
Simple tool to help you talk with your patients about, cosmetic information. The other thing is it really shows your patients that they're doing a great job at home. And even though they're doing a great job at home, they still need to come back in 6 months because almost everybody will have some sort of calculus, some sort of buildup on their teeth. So it's a great tool to help you, close the door, if you will, with your patients for them to come back.
I see. And I totally can share that because even me, although I'm a hygienist, when my dentist says stuff, sometimes I'm a little skeptical. And even my sister, because she's my dentist, she's my sister, she had to take the intraoral camera and show my fracture because I'm like, I don't wear, I wear a night guard. I do everything that's required. I don't need that. But she's like, no, you have a fracture. I don't know how the hell that happened. And she showed it to me.
That's so funny, Claire, because I had the same experience a couple of months ago. I lost a filling, and I said to the doc, can't you just put a filling back in there? And he took the camera out and said, you need a crown. That happens to us in the dental industry. So those 3 things so far, the medical history, the x-rays, the intraoral camera.
Wow.
The next thing, the 4th thing is periodontal charting.
Okay.
A huge must. You don't know what kind of cleaning you're supposed to be giving your patients if you don't assess them thoroughly with periodontal charting. Unfortunately, early in my career, I worked for people who didn't even have perio probes. So that's something, and again, I have that in my notes for the interviewing part that you want to talk about.
Okay.
You want to know what their protocol is, what their stand is on it, and if you agree with that.
Okay. Totally.
Know the numbers. Your patients should know their numbers.
I see. It's a good point. Numbers speak. Like, I really feel like even credit score, like it's a number, but that number says a lot about, that's what the banks look for. That's why the investors look for. And it's such a simple number too, periodontal charting, 4, 5, 6, those are the red numbers. And if they hear it, they should know what it means at that point. And I think, sorry, just tying all this together, I really feel like if we challenge ourselves to do that, like all of the 4 points that you just mentioned, intraoral camera, charting, x-ray, there's no way we're going to stay stagnant in our profession and feel bored of doing the same thing over and over again, because every patient is a new challenge. Every patient is going to feel different. And I feel like we talked about the burnout, but it's less likely to happen if we push ourselves to be that awesome clinician.
Right. And the most important thing actually is the next of the 5, which is asking your patients what's most important to them. What matters to them.
What matters to them.
I worked so many years and not ever asking my patients what is their goal of their mouth. Do they have a goal? What is important to them? I just clean teeth. And it wasn't until I kind of had an aha moment maybe 7 or 8 years ago when I interviewed at an office. And he said, well, why wouldn't you? Because that asking your patient what's important to them ties everything together. It allows you to really develop a plan for them because everybody's going to be different. We know that they need dentistry done, whether it's restorative, preventative, periodontal plans done. So that allows us to tie everything together.
Okay. And Cindi, can I ask you something? I feel like we lost your microphone a little bit.
Is that better?
Yeah. Okay. Maybe just the distance. Okay.
Okay.
All right. Awesome. So to tie it all back together, what matters to them, ask them. If it's whitening, I mean, you started there. You talk about it.
Yeah.
Right.
Absolutely. But if what's most important to them is whitening, let's use that. How can we get you to have a whiter smile? We can talk about whitening. We can talk about coming in a little bit more often for cleanings and get polishing. There's so many things to be talking to your patients about that, but if we don't ask them, then we don't know what's important to them, and we can't tie what dentistry we want to do for them that we know they need to those things.
Awesome. Because we talk about chief complaint, but that's, I feel like, different than what they really want to talk about.
You're 100% right. Their chief complaint and what is most important to them are two different things.
Okay. So by textbook, guys, it's all chief complaints. Okay. But in real life situation, we got to connect with them.
Well, that's that practical application that we talked about previously. Was we learn all of this information in a book, but then when you go into it hands-on in the dental office, when you first start out, it's overwhelming to really give that information to your patients.
Okay.
And it's most important for your patients to just know the bottom line. Then if they need periodontal scaling, then that's what you're going to be talking with them about. If your patient wants to know how they're doing it, how the hygienist is doing it, then that's the information that you need to give them. If they want to know what their insurance pays, then that's what's most important to them. You know, it's individualized.
Okay. I feel like the hard part here is that, let's say they want to just know like how much insurance will cover, because most patients like work around insurances, and that's a reality. And we, you know, as a hygienist, we're taught, okay, well, your job is more important than that. You know, you have to tell the patient what they actually need. So how do we find like that awesome, you know, line where you meet the patient's expectations and needs and concerns, where you are still doing the best you can as a clinician? And I feel that's a very philosophical. I mean, a case by case, every patient is different. And in a way, the more I hear you talking, it's like we are more very like we're not like what do you call it?
Psychologists.
Yeah, we're like psychologists. Yeah, in a way, to our patients, like, oh my God, what do you need? Like, how's your life going today? Yeah. So that drains a lot out of us too, because we give a lot. Yeah.
It's very difficult some days to come to work when you hear your patients' stories. But I think that really is the key element, is finding out what's important to them. If what's important to them is to come in here and have no pain, well, then that's what we should be doing. If it's most important for them to come in here and not hear about their dentistry, well, we still have an obligation to talk to them about it. But, you know, they don't want to hear the details. So it's very individualized. And that's what I said at the beginning of my career, and many hygienists that I talked to, we just went in there and cleaned teeth without caring basically what our patients wanted.
Ooh, awesome. I learned already. I'm going to ask patients now, you know.
I will tell you, it changes your career, it changes your relationship with your patients, it changes the game, it changes everything once you start asking your patients what's important to them.
Oh, awesome. What is the one sentence can we use? Can I say, for example, let's say my patient name is Sarah. Can I say, Sarah, what's important to you today? Can I just say that?
I say that all the time.
Okay. Guys, let's repeat this. What's important to you today? And then it's going to open up, build a relationship. It's going to feel different.
Well, and then they also understand that you care. You know, you're there for them. Yes, you're there to clean teeth. But if you understand what's important to them, they feel that you're listening to them. And it's true. It's true. I have a really good rapport with my patients, the staff that I work with who really understand this concept, do really, really well.
Awesome. So you coach your own staff to do this, and it works well.
It works very well. Well, I mean, because what's important to me is different than what's important to you, Clara. What's important to the next person down the road is, you know, absolutely. I mean, but you don't know that until you ask. You can't assume it either.
Yeah. Okay, I really love this talk. Again, it changed me already.
Thank you.
And, you know, I know there's many topics we want to cover because we want to give out the maximum we can in 1 hour. And if it's okay with you, Cynthia, I want to jump to our next point where we said, okay, you know, let's show us new grads and even existing hygienists how to just a quick tip about tracking your numbers, because we don't track our numbers well. We get out of school not knowing a thing about dentistry, actually about an office. We know dentistry, but not like how an office works, how you should be compensated. And you often go and they don't want to pay you really like what you thought you were going to be paid, you know, and that's all just a game. And you have to be on track, tracking your numbers as well to prove yourself. So I really was excited about talking about some numbers with you today, Cindy.
Absolutely.
Yeah.
I think there's a few numbers that we can track.
Okay.
You know, production per hour is one of them.
I'm going to write it as you speak, okay?
Absolutely.
Yeah, so you might see, I don't know if you're going to see it.
We can see, I can see.
Okay, production per hour. Okay,
Per hour.
so saying in 1 hour, how much do I make for the office?
For the office.
Okay.
And then you can track collections. There's a little bit of a glare on there.
Okay, so I think it's the angulation of my screen. What, is that too much glare?
That's better. No.
I think it, you know, it's okay. I want to stay right here. It's the light that changes with my movement. Okay, go ahead.
So production per hour,
Uh-huh.
collections per hour, because we can produce a lot of money, but if we're not collecting it,
ooh, you're right. What's the point?
What's the point?
Okay.
Absolutely.
Okay.
You want to check and track next visit set. So you really, really want to make sure that you're setting your patient's next visit.
Okay.
You really want to make sure that your patients are committed to coming back to you. As we know, maintenance is the key to all the work we're doing. And you really want to protect they really want to protect the investment. You want to protect their investment in their mouth. So tracking that. You also want to track if your patients are actually coming back.
Ooh.
So, I mean, those four things are really key.
Okay.
I mean, they could be making their visits, but are you empowering them to come back to see you? Going back to what we just talked about, giving them what's important. Did you clarify that what's important to them, and are they really wanting to come back to see you?
I see. Okay. So let's say really a hypothetical or a real scenario. Let's say Sarah again. You know, she came today and I did a procedure, and let's say a prophy that was covered by her insurance was billed. The production per hour would be how much should we say?
Well, I guess it depends on where you live. So I would say if you were going to do x-rays, prophy, and an exam, maybe $265.
Okay. Let's say I'll just say 270, okay?
270, okay.
270, okay. We have 270 again. That includes the x-ray and all that. But again, you have to check with your receptionist. Is that a good place to start to get those numbers?
Well, you can track it generally in your dental software.
Okay.
Yeah, so we're kind of talking broad here. You know, it depends on what software you're using.
Okay.
But you can track that. I mean, if you're seeing 8 patients a day, and you know, say, you know, if they have no insurance and it's $100, you know, $800 a day.
Okay.
I'm just talking in generalities. You know, you're collecting that as well if they don't have insurance. Now the collections per hour is a big thing because like I said, you could produce all sorts of money, but if we're not collecting it from the insurance company because they're, you know, an out of network, they're not covered by the dental insurance, I mean, those sort of things. So we can get into probably a whole nother discussion about how to collect on insurance.
So what we have to do, I think, is that let's say we had 270 billed, but how we collected, let's say 1 month later, it depends on, again, on the insurance or when the patient paid. Maybe they pay immediately, that's immediate collection. Anyhow, when they pay, you say, okay, out of the 270, did they pay actually 270, or the insurance didn't want to do that and they ended up with $200 or something like that? So let's say it was $200 because something happened and then they couldn't pay or something. So you're actually collecting $200. Okay, awesome. And then I would say when you have this number, then you multiply, you know, you see per day. So how much you generally produce. Let's say, like, you know, this month in May, you know, every day I kind of stacked it up and I said, okay, I produced, well, if it was, let's say 200 multiplied by six patients, that's 1,200. So I did 1,200 and you add it up and then you divide it by the number of days and it gives you a general idea of per day.
Correct.
Right. Is that an okay way to do so, to kind of start tracking? Okay.
Absolutely. You want to know what you produced per day, what you're collecting per hour as well. Those are really tracked through your dental software. The industry standard is to be producing about 3 times your salary. So if you were, say, to make $40 per hour, you really want to be collecting and producing $120 per hour.
That is a great number, guys. If anybody is curious about how much you should say, hey, doctor, I produced this much, give me a raise, you need to start with, do I even make 3 times what I'm making hourly? And then you can start having the conversation. Because if you're not, probably not going to go anywhere yet.
Right, right.
And there are some more things to track, right? Such as, I remember in your example, you said sealants. Okay, that's extra.
Sure, absolutely. I believe in sealants for patients who want them and who are good candidates for them. Now, that can increase your production per day and per hour as well. You know, you have a young adult who could benefit from sealants, and unfortunately, they're not covered generally by an insurance company. That doesn't mean that you shouldn't be offering and doing them for your patients if they're a good candidate. So if you did 2 sealants for 3 patients a day at $50 per sealant. Well, that's an extra $150 added to your production. I also believe in fluoride for patients. You know, we have a lot of risk factors for even adults. I mean, it's generally covered by insurance, but just because it's not covered by insurance doesn't mean we shouldn't be offering it to us.
Exactly, yeah.
You know, again, that goes back to, again, what's important. If no cavities are important to your patients, then these 2 things, sealants and fluoride, should be offered to them, regardless of insurance coverage.
All right, and then the big, I mean, you know, scaling and root planning, that takes a lot of time, and also it's billed at a higher rate as well.
Correct, absolutely. So say you throw in 1 or 2 scalings a day there in your 8-hour day at $375 each. And I don't know what your, you know, where your state is and whatnot, but you know, that will increase your production as well. So it kind of comes back to kind of full circle. If you just do prophies and prophy and prophy and prophy every day, you're going to get burned out, number 1. Number 2, you're not going to be producing you know, a fair amount to cover the salary for the office. So when you start adding things that are beneficial to your patients based on what's important to them, you'll increase that. And what that does is it does a couple of things. First of all, you're recommending things based on your assessment. If your patients, you assess them and they need them, then you're recommending these things. Number 1, it's helping your patients. Number 2, it's helping the practice. Number 3, it's helping you not to just do prophies and not to burn out. So it's a really, it's a big circle there, if you will. It also creates value for your doctor that you're working with or the practice that you're working with. And then by doing that, you can talk to them about new instruments, new ultrasonic inserts. What about this new technology? Let's try this. You know, those sort of things. So it provides value. You're investing in the company, and in turn, hopefully your doctor, your company will invest back in you as well.
Okay. I feel already more comfortable, and I'm really glad that we showed a little bit of that. And then the last thing is like the next thing, if they come back, I just quickly thought in my head what you were talking about. Okay, why don't we do this? Let's say like right now in May, I said, okay, it's 6 months. So they're going to come back in, let's say they said December, okay? Usually you have to use your insurance by December. There are a lot of people like that, right? So let's say Sarah needs to come back in December. I don't know if I can use any like, you know, planner like that. You know, this is my quarter planner. So there's only 4 months here, but if you had a whole year planner, maybe you can say, you go forward actually in December, and you just make a column that says December, and you write down their names, Sarah and then Paul, whatever they are. Maybe not their last name. I don't know. Maybe we can just an initial. I don't know if it's a HIPAA problem or not, but say I could just check them saying like, did they come or did they not? And that kind of gives you a quick tracking of the next visit and did they come back or not. I'm just trying to think in my head how we can make a tracking system for ourselves.
Well, that's a hard one to do, and sometimes your dental software will do it, and you know who's scheduled, you know, in your continuing care box, those sort of things. But I will say to you that you really should be between 90 and 95% of your patients pre-scheduling.
I see.
Okay.
99.
And at least 75 to 80% of them, you know, people move, those sort of things. So at least 75 to 80% of them should be coming back to you.
Okay. Woo, good numbers.
Yeah.
So we have some goals now, which is great. 3 times, whatever your salary is, and about, let's say, 80% of comeback revisits.
Absolutely. And it's important because, again, you can use that as leverage to your doctor when you're talking with him about things like new instruments, raises, bonuses, those sort of things. So there's great value in those sort of things.
And, I would also even say, not even like sometimes, I mean, we might not ask for a raise, but it's a good reminder to whoever the employer is saying, hey, look, like I've done everything that I'm always supposed to do. I'm just showing those to you today. And, that's it. Like I'll come back to you in 3 months. It's just like a check to ensure that your employer is happy and understand the value you provide, although you're not asking for something. At that point, it's not only leverage to ask something.
Yeah, absolutely. Right. Are you an asset to where you're at, or are you just, getting a cup of coffee when there's no patient?
Yeah.
Are you really creating value in your company and in yourself as well?
And it's a good check. Yes. I mean, like anything, the reason why I have a planner like this, it's always like it builds a practice of like, do I keep my own goals? It has nothing to do with anybody else. Nobody gives me a prize. But can I keep up with what I promised myself to do?
Well, what I think about goals are not just to achieve the end result, but goals are to learn something about yourself while going through it.
Oh, I see. Because things will happen. You'll learn about what kind of person you are, how you overcome that, how strong you are or not, all of those.
Right. Or if it was too big a challenge for you to do, and not giving up on it. But I think that the value in that is learning. The goal, the end result of the goal is to learn about yourself, not just to achieve the goal.
Okay. Great. Woo, so already we are halfway through our interview today. I already learned a lot about those kind of numbers that we have to care for, and also how to kind of prevent the burnout. We talked about some real practical things, such as make sure you ask questions to the patient about what they want, what's important for them. Make sure that there's periodontal charting, intraoral camera, a radiograph going on, and medical history. Now, let's assume all of that is great in our practice. We still need to be hired, right?
Well, that is a big thing, and that's a very scary thing for a new hygienist because you don't have practice. And I know as a person who interviews for a company, I see a lot of people, and I have hired right out of school. So there are people who will hire you.
Okay, so you interviewed a lot of people, right? From, again, new grads to experience to not just dental hygienists, but you also interviewed many different positions in the dental industry, right?
Correct.
Okay. So I would love to share things that you can share with us about. My first question would be on behalf of our new grads saying, okay, what should I not do?
Okay. Actually, this is one of my favorite things to talk about is interviewing, because I actually really do enjoy interviewing people, and I learn from them. I would say the biggest thing as a new graduate is clean up your social media.
Okay.
That would be the first thing, because employers will look to see what's out there on you. So I would just say, as a number one rule, clean up your social media.
Wow. Okay.
I would say the other thing when you're going for an interview is to be prepared. Know what kind of office you're going into. Take some time to investigate the office that you're going to.
Right.
Be professional. Unless you tell the person that you're going to be coming from work and you're wearing scrubs, I would not wear scrubs.
I see.
We understand that, and I absolutely understand that when somebody says something to me about that. But you're going to interview for the position in business attire.
I see.
The other thing is be on time. Really be on time. And things happen. Traffic happens. So then know your way to get there.
Yeah.
Even do a practice run before you get there.
Okay.
When you do get into the interview, don't chew gum. I know you're nervous, and that's okay, but it's not very professional to chew gum, and some of us don't think about that. But the interviewee, it's very distracting for the person who's interviewing you.
Awesome.
I would also have several copies of your resume.
Okay.
Not just one, because if sometimes you could be interviewed by a few people and you want to hand them something. So have several copies of your resume. I would also have several copies of your references too. And as a rule, please make sure your references know that that people could be potentially calling you for references.
Okay. All right. So can I ask you a question on that? So before the interview, I'm assuming the employer has the resume and the references already, but you're saying give extra just in case.
Correct. Again, that's that be prepared. Be a little bit over prepared, depending on where you're going. Have a couple of copies with you.
Okay.
You don't know if it's going to be the dentist, the office manager, the hygienist interviewing you. So at least they have some sort of, people want to see things on paper. People want to make notes on it. So in my experience, I've, unfortunately interviewed for a company a long time ago, and I didn't realize I would need them. And I looked silly when I went and interviewed, and about 4 people walked in for the interview, and I had nothing for them. So it's just really good to be prepared for the references and the resumes.
Okay, and the references, you're right. Sometimes we say, okay, our previous info would be my reference. We didn't exactly tell them that what might happen, which makes it really awkward, right?
Yeah.
Okay.
Absolutely. I'll always ask somebody, is it okay to, oh, God bless you.
Thank you. It's just allergy season right now.
It's bad, I hear you.
Yeah.
I have a take on that. First of all, I'll ask them, and I would never contact a employer that they're working for now unless they said it was okay. But I do ask for references, and I do call because, I want to know about this person that's going to be coming on board.
Okay. What about some references that are non-dental? Just because, you're a new grad, we have nothing. When as a new grad, can it be some other work experience, my retail?
Absolutely, 100%. Okay. I've called people who were nannies.
Right.
Becoming a hygienist, their family. I've called all sorts of references and all sorts of types. So it shouldn't just be one industry. In fact, I actually like that when I have different industries to call for reference.
Wow. Hey, Cindy, can I ask you something? And so you are an expert in this. And being on that other side of you calling the reference, how long does a reference call even take?
What do I ask?
Yeah, and how long does it take?
It literally maybe takes about 5 minutes at the most. I probably ask a few open-ended questions, simple things like, were they on time? What were they like when they worked with you?
Okay.
What would their coworkers say? What value did they bring to the office, or whatever industry it was? Would you hire them again?
Right. Got it.
That's a big one.
Got it. So it's nothing too complicated. It's really just a check to say the person is a good working character, like someone we want on our team.
That's exactly it. And if there's hesitation, that tells me a lot.
Right.
Unfortunately.
Okay. And you can say, people like you who are recruiters can tell by someone's being a little, not so warm about their response, saying, that might not be the best. Okay.
And then I'll probe a little bit more. I'll talk a little bit more about that situation,
All right. Got it. And then, okay, so resume, that was a great tip. So now we were going through some advices for the new grads, and I really love clean up your social media. Obviously, we don't want to, right? But does social media mean Facebook, or does that also include Instagram?
I would say Facebook is the one people are going to really look at, to be honest with you.
Yeah.
I would just clean it up.
Okay.
Just in general, this is a very professional, this is part of the medical industry, and us, we want to be looked at as that. And it's unfortunate that not everybody thinks so, but in my experience, you really just want to clean that up and get on a professional train, if you will.
Got it, guys. Clean it up. There's no quick answer to that. But one thing good about Instagram is that they can't really search you by your name. It's like your whatever Instagram name could be, like spring in the summer, whatever it is.
Can I make a
So
suggestion on that? I would make, if you have a personal account, I would make a professional account.
ooh, okay. A professional
All
account.
things linked to just a professional account, because you know, people will look you up and you just want to know. I mean, I've had patients look me up on my social media.
Oh, wow. Yeah.
And I have a professional part of it. So
okay, okay. What about LinkedIn? Like as a new grad, I don't think we really think, okay, I need a LinkedIn profile. Is that something desirable? That's not exactly what we need to
I think any platform is desirable.
Okay.
Get your name and to where you want to go. I mean, you really want to think about, to be honest, before you even go for the interview, what kind of hygienist do you want to be? What kind of practice do you want to be in? What kind of hygienist do you want to be?
Okay.
Do you want to work in pediatric? Do you want to work in prosthodontist? Do you want to be in a large practice? Do you want to be in a, you know, mom and pop that doesn't work, you know, past 5 o'clock in the evening? So, you know, just think about where you want to be.
I see. Okay. I got the message. So you have to kind of create your own persona, your brand, your vision first before you even interview. And that translates to social media and everything that you do to present yourself.
Correct. Yeah. Make a good presentation. Absolutely. So when you're in an interview, I think the one thing that you really have to work on before you get there is have an elevator speech or have some sort of, you know, representation of yourself, because one of the first things I ask is, you know, just to break the ice, tell me a little bit about you.
Yeah.
You know, I make it a very warm, friendly environment with them, but I want to get to know them. So I'll ask a simple question, and I was surprised when I first started it that it was really difficult for people to talk about themselves. So have some sort of few sentences, a minute long, 30-second long elevator speech about yourself.
Okay, okay. An elevator pitch, okay. For those who need to be more familiar with this would be, let me try quickly, you know, I usually use my profile when I do other things than, so anyway, sorry, I lost my, so for the elevator pitch would be, hey, you know, when you ask me, okay, tell me a little bit more about myself, I need to be ready 1 minute to give you a little bit of synopsis about myself, right? Saying, hey, my name is Claire. I graduated 5 years ago from Forsyth School of Dental Hygiene. Since then, you know, I practiced periodontal practices. I spoke, I wrote for magazine. In fact, some of my articles, you know, went top of RDH magazines. But most of all, I'm really passionate about helping each and every individual and understanding their needs and making their life better.
There you go. That was great.
That's the elevator pitch.
You know, it doesn't always have to be about dentistry either.
Okay.
You know, graduates, it's a little bit difficult, but you know, you can, like you said, say what you're passionate about. Do you volunteer? You know, I volunteer here. I would love to do this. You know, I want to do this in the future.
Oh, okay. So it doesn't have to be just dentistry. It can be also, you know, I have a great passion. My sister does for like special needs, so we volunteer on the side for things like that. And also, you know, on my free time, I have to play with dogs. Even that. Is that okay?
Absolutely, 100%. I want to know. I want to get to know the interviewees personally.
All right. Sounds a lot more. I mean, it's easier now. I get it. It's like you want to just a little warm up for both of you to kind of start a conversation. And this is a great little basket of things. So you can pull things out from that basket. Say, hey, you said you like dogs. Hey, you said you wrote articles. Like there's more conversation going on this way.
Yeah, creates a connection. You know, creates a connection because you're human, and this is a nervous thing going into an interview for somebody you've never met, and hopefully you want to get the job at.
Awesome.
I would say another thing that you really want to do is ask questions in the interview.
Yes. And you know, we have so many questions about what questions should I ask.
Okay, absolutely. You know, there's a couple things I wrote down. The other thing with interviewing is make sure you make eye contact with your interviewee.
Yes.
I know it's a very nervous situation, but making eye contact. Asking questions, you know, such things as, is there room for growth here? Do you value and participate in continuing education? What was the last class that you took your staff to? It really just shows, when somebody asks me questions and goes back and forth with me, it really shows me that they're curious, which is great, because then that parlays into that they're going to be curious about their patients and dentistry as a whole long term. You know, I can really tell right away if somebody doesn't have any questions. So going back to what I said earlier, know the company that you're going to be working with, know the doctor that you're interviewing with, and then you can ask them questions about them. You know, how long have you been in practice? How many patients do you have? What is your continuing care about? How many patients are returning? Those sort of things. So questions, questions, questions. It's a big positive for an interviewee.
I see. And I share with that with you too. I do interview in my job for other things, not really working for the private practice, but you know, writing or things like that. And if the candidate doesn't ask me any questions, I feel like they're not interested enough.
Correct.
And I don't, and it's not the best impression, because I feel like, okay, like you think you know everything, like, because things are going to come up and you will need to ask me stuff. And I don't even have the answer all the time. But I feel like there's not enough collaboration. So I think it's a great way to show that you can collaborate.
Yeah. Asking questions is key. Just like you said, it really shows that you're interested in it. And lastly, I would say that at the end of the interview, you really want to ask a closing question, as something such as, you know, is there anything holding you back from hiring me? Because then what you'll do is you'll get any objections or anything that the interviewer is having trouble getting past. So you really want to know if there's anything holding them back from hiring you. Then you'll know right then and there if it's going to be forward to a working interview.
That one is so powerful. I never actually really thought about asking them right there, is there any objection? Because in sales, I mean, I am also do something else in sales anyhow. We always ask people, the client, saying, is there any objection? So we can provide either the answers or give them directions or clear it up, because sometimes the sale doesn't happen, not because, you know, it's a bad product or you're a bad person, just because there was something missing there. So you're just trying to close the gap. So it's okay to ask, hey, do you have any objections?
I love when an interviewee asks that. I actually ask that as well. My end of my interview when I'm interviewing potential employees is there anything holding you back from taking the job? So I want to know both. You know, I want them to get ask me that question. So then if I had any objections for them working with me, I would get it out on the table right away, rather than them going home and wondering, is she going to call me back?
I see. Oh, I love it.
So you know right away.
I love it. Everybody take notes. Just ask right there, clear it up, clear the air, and there's no more anything. Oh, this is a huge. Okay. Yeah. Thank you so much for sharing that. Wow. Okay. And we talked about asking questions about the office, such as like radiograph. What is your protocol for taking radiograph? Do you have a periodontal charting system?
Right. All of those things. What is your X-ray policy? What do you
okay.
Who makes the appointments? Who cleans up the rooms? Who, you know, is there anybody to help me perio chart? Those sort of things. So again, if you don't ask questions, then you're not really engaged. And that is probably one of the biggest things, is if an interviewee is not engaged, then they're probably not a good candidate for.
Okay, so be engaged. Oof. All right, and can I ask you, so you interviewed a lot. Are there some red flags you say, okay, whatever you said here, because you said that, I really cannot hire you? Were there moments like that?
You know, I understand people have difficult times with you know, working evenings or weekends or those sort of things. But if I continue to ask questions and they say no to every single one of them, I would say to new graduates, be open. Be open to saying yes to things that you may not even know how to do yet. You can say to them, I'd love to try that. I may not know how to do it, but what that shows me is a real, you know, go
Okay.
with attitude about things that, hey, you may not know how to do it, but some of the best things that you can learn is through that trial and error. And if somebody says no, and I also watch, I watch body language and eye contact when I'm with because, like I said before, eye contact is really huge. You're working with the public, and you really need to be engaged with your patients. And if they're uncomfortable with me, they potentially probably will be uncomfortable working on
Okay.
patients.
Got it. Got it. So going back to, there must be a lot of no, especially when you're new grad saying, have you used this before? Have you used an indoor camera? I mean, there must be a 500 million no's that I can say that I didn't do. Have you used the instrument? No, you know, but say, if rather than say no, I mean, obviously we have to be clear and honest saying, I haven't, but I would love to try it. And I'm a quick learner. I can Google it, first of all. I can ask some friends. I attend a lot of continuing educational courses. I read magazines, the dental magazines, articles. I'm sure I can figure it out. Something like that.
Right, absolutely. When somebody says no and it's a hard no, then I know that they're not able to be coached into doing things. And
So
they're sedentary in their ways.
So there's more to that just no. It's like the attitude about, okay, well, if something else comes up, you won't try to be flexible.
Yeah.
Awesome.
Absolutely. I mean, I didn't know how to use a lot of things in the beginning, but what I did was, I have not used it, but I'm willing to try. Can you teach me?
Yes.
That's an open-ended. Can you teach me? Let's go now and let me show me.
You can ask that too, right? In an interview,
Absolutely.
can you teach me? Or can someone in the office teach me? Or maybe the rep can teach me or something. I'm open to that.
Yes, attitude is everything with interviewing.
Ooh, attitude is everything. I think that's going to be my quote today.
Oh, I like that. I like that. And I really do try to do an 80-20 rule. I really try to listen 80% of the time that I'm interviewing. And so I would want the participant to be talking.
So Cindi, let's talk a little bit about you listening to 80. That means the interviewer talks a lot. That means if you interview me, I have to come up, I have a lot to explain. That means I need a lot of preparation in advance, right?
Yeah, well, absolutely. And that's one thing I said in the beginning, you've got to really be prepared. The other thing is, you really want to interview the office that you potentially want to work for. So not only am I interviewing a potential candidate, but you as a candidate want to be interviewing this place that you're going to be working. You really want to know if this is where you want to be and this is the kind of office that you want to be at. So you really should be asking questions. Don't take something on that you really aren't prepared to do.
Okay. For example, I mean, I can think of many offices that I went to, not necessarily interviews, but I can think of sometimes if they don't have a panel machine right there in the office. Sometimes I know it's an obstacle in like patient care, like to make quick decisions and move on. So, you know, I can ask them, do you have a pen or machine that you use in the office? Or do you have certain specialists that you are ready to refer to? Because I think that's very important, the chain of referrals. If there's a blockage there and I don't know, we don't know who the periodontist we should call, you know, things like that can be.
Absolutely. Asking questions. I mean, you know, what kind of instruments do you use? How often who sharpens them? Do you send them out to be sharpened? Those sort of things. You know, in our industry, there's a lot of questions to ask. And I would actually, to be honest with you, prepare those questions in advance because you do get a little nervous when you're doing an interview. Some of my best candidates have come with questions already ready to be asked because they were prepared. So
okay, and let's say it's hard, we're nervous to ask those questions, is nerve-wracking. Can we write a little note, not on the phone because it looks bad, so on a little sheet of paper? And I'll be honest with you, Cindi, you know, can I quickly ask you a few questions about the office? Can I pull my quick notes and ask you? That is okay.
I've had potential candidates on their phone, written down all sorts of ways, absolutely. Or they'll even email me before they come in to interview. I'm fine with either way because technology is where it's at. Everything's on our phone.
Yeah,
that's fine. But the key is, do you have something prepared? Are you prepared to ask questions? If they say no, and they ask me nothing, then
okay. And that would be really personal, I feel like, because one thing that's important for a dental hygienist might not be important for my other friend. For example, if working Saturday is a must in the office, it's okay with me because I don't have a family. But if my friend has a family, it's hard for her to take Saturdays to work. So I think this list of questions you should ask the office really depends on the person.
correct. It depends on your circumstances, and like I said, it really depends on what kind of hygienist you want to be and what kind of office you want to work at. So you got to tailor the questions to where you're going, because you wouldn't probably ask some certain questions of others depending on where you're at.
Okay, okay. Oh, I learned so much, and I can relate to everything you said because I've been through that process. And if you're a new grad, never been through that process, just write a few things that we talked about today and make sure that you get your attitude, get a good attitude, because our quote today is everything. Attitude is everything.
Yeah, take a breath before you get in there. They're human just as much as you are. They've been in that shoe a long time ago. Everybody started somewhere. The key is to just start.
Okay, and eye contact, positive body language, lean in.
Yes.
With your hands open, not folded.
Yes, absolutely. Smile. We're in the industry of smiling. Smile.
Yes, yes. And ask them, can you teach me? Be open.
Yeah, absolutely. And the biggest thing is, ask the closing questions so you know right away if there's any objections for them hiring you. And if it's, if it has to do with the experience, well, can I come in and observe? Can I temp for you? There's all sorts of ways around things.
Great. So you find your already answers there saying, okay, there's an objection, and the objection is, oh, you're too new. Like, we don't do new grads. And awesome. You can say, can I start temping then? Can I follow one of your hygienists and maybe I'll learn better this way?
Correct. Can I come in and be her assistant? While you're waiting for your license. Be a hygiene assistant. Take a few hours out of your week. I mean, ask not to get paid.
Okay.
I mean, there's all sorts of. You have to think outside of the box.
Okay.
All sorts of ways.
Oh, I love it. Okay, guys, outside of the box, we don't take a no or, oh, maybe it's not going to work for you, as a hard no. There's ways to wiggle your way in if you really want to, but it takes work.
That's the key. Do you really want it?
Okay.
And like I said, I've interviewed people that just, it wasn't working for us right then. And I said to them, I'm going to call you in a few months, and I think that we're going to have something special together. And I've hired a few hygienists like that it just wasn't right at that time, although I knew the potential was really strong. And we just waited a little bit until it was the right time. So even if they say no, it just could be right now.
Right. Got it. And the last thing I wanted to ask you is, so I had this, I teach also our new grads how to interview, like more like a, verbiage, the questions you should prepare for. Like I give them a form saying, fill this out before you go there. I have something like that. But one thing I talk about is tell stories, not just I can do A, B, C, D, and E, but kind of put it in a format that the employer can absorb, saying, okay, I had a patient, and even if you're at school, don't be afraid to say this was in my rotation or something. It's okay. Like you still had a patient. So, in my rotation, I went to the community oral health and we didn't have toothbrush. So I called offices to get toothbrush. Anyhow, my point is wrap it around a story so it's believable. You take them to that place so they can start imagining all the things that you have done, make the feel good kind of thing going on. So do you agree with like trying to convey stories?
I love that, because then it creates a personal touch for them to see you as a real person, and then somebody who cares. I love that. Okay. It gets a connection. It really touches the potential employer. I love that fact. Awesome. And you can't just all be matter of fact when you go in. And that's why, like I said, I really try to break the ice with a potential employee. Tell me a little bit about yourself, because then I can find some sort of connection, whether it's volunteering or animals or, going on mission trips or whatever the case may be, or their past experiences of what they did in their other work. So, yeah, personal is the key.
All right. So we need that personal touch. We have to know ourselves before we get there as well. We have to be prepared, have a positive attitude, and elevator pitch.
Absolutely. Practice it. I would practice it. I would role play with a family member, role play with somebody, you know, absolutely. This way you don't flub up your words.
Yeah, one thing I'm doing actually, it's completely side story, completely, Cindy. I memorize decks of cards.
Oh.
I know.
That's a good memory.
Yeah, I train memory. I train people to do memory. So anyhow, you know, it has nothing to do with this. But one of the tips that we have is you're very nervous doing this in front of people, right? So we say, practice in front of goldfish, your cat, your dog, your grass, whatever it is. Pretend that's a person.
Yep.
So your elevator pitch, that's what I'm getting at. Practice it in front of your chair if you have to. You know, pretend there's someone there. You don't need a real human until you feel a little bit more comfortable. You can invite your parents if you want to.
Absolutely. I practice in front of my dog and my children when I have to speak as well. My dog doesn't talk back though.
That's great. They just listen. That's great. You want that confidence. Perfect.
Active listener.
All right, Cindy. It's been already an amazing 1 hour. I really thank you for all the wisdom you shared. You shared so much more than I could ever share on my own to our student RDH and our new grads and our existing hygienists. That's why I love inviting panelists like yourself to really get this wealth of information. And I would love to just post this also online just so that others can listen to this, because again, it was a Wednesday afternoon. It was a little hard for people to get to this. And I even have an email I quickly check saying, oh, I can't get to this right now. So I'm going to share that. And Cindy, I just really wish you the best in everything you do. You know, if we can do something to help you, you know, in your practice or anything else, please let us know. And Dominic Porto, she's saying, thank you so much, Cindy. And she says she learned a lot.
Thank you.
I see this on my chat right now on Zoom.
Thank you. I'd be happy to answer anybody's questions. And I really appreciate the platform and opportunity with you, Claire. You've been wonderful.
I was choking on my, but thank you so much. And I really want to encourage everybody out there to be like Cindy, grab your mentor.
Yes, absolutely. Grab your mentor. What is the worst that they can do is they can say no, but you know what? Then they weren't for you. There's so much value in learning and ask. Put yourself out there. Network, netweave with people in your industry, outside of your industry. And like I said, if anybody wants any questions answered, if I didn't answer anything, I'd be happy to do it as well.
Awesome. There's also Anna who's saying thank you. Jerusalem, Nori, we have a lot of love here. Allison who says, thank you, Cindy. I really appreciate both taking the time to share this valuable information. So we're going to end this on the great note. Absolutely. And see you online as well. And I'm sure, our listeners are going to love it further down the road as well.
Thank you. I look forward to it. You have a great day.
You too.
Thank you. Bye-bye.
Bye.